So first of all, the first question that came in is how can the church handle the new normal after being locked down for months and maybe still in lockdown and using Zoom for services? And maybe you've seen some creative programs out there that have helped that. I know our church, we do so much on Zoom. We have our youth fellowship and our young adult fellowship, and we do Alpha and Rooted, and our senior citizens have their own group called Vintage. But what are some, have you seen some ideas of what we could do on Zoom to really help our congregations or the community?
Yeah, we actually have, we transitioned all of our, at the Hope and Healing Center, all of our therapeutic services, we transitioned over to Zoom. So we actually do telehealth now for everything. But we've been helping churches transition their support groups to Zoom, even their pastoral care. I think one of the things that we've done, as a church is I think this really has shown us, we're very building focused. I mean, we are, you got to come to us. I mean, we're in this one spot. And if you want help or whatever, you come over here, we'll give it to you, but you got to get here. And I think, we really need to kind of rethink how we do that. I mean, obviously, as you said, we can take advantage of things like Zoom. I think also we might want to start thinking about having ministers within neighborhoods, where you don't have to go, maybe you feel more comfortable talking to your neighbor as opposed to driving, across town in the context of the pandemic. So, I think with Zoom, transitioning pastoral care particularly and support groups is really kind of the first step in being able to do a little bit better job of kind of reaching out beyond the building.
Well, yeah, and I hope the community understands everybody's trying their best. This is
Right.
a real different thing, and most churches weren't ready to go online
Absolutely.
in 5 days like we had to, or all churches had to, and we're all trying to figure this out. So I hope everyone understands. Everybody's trying their best. For our church, we were thinking, how do we create more bonding and community? And so in a couple Sundays, we're going to be doing communion for the first time.
Right.
And trying to set that up. Everybody, the week before, get your juice, get your bread
Right.
ready. And at first we didn't want to do that. Well, we didn't know how long this was going to last. And we thought, oh, that's something corporately as a sacrament we want to do. But now we're feeling, how do we do this through Zoom, create community? And so, and again, everybody, we're going to launch through these questions. I'll try to get to as many as possible. There's no possible way I can do all of them. So please don't feel I'm rejecting you in any way, that we're just trying to get through these. And all of you are important. And whether or not I get to your questions, you're very valuable in our eyes. So here's a very tender text that has just come in. It says, oops, I just slid by. So hang on, it's coming up in a second. Okay, it says this: I'm a person suffering from painful mental illness. After a family tragedy, symptoms became overwhelming. I've been away from church for a few years. It took a great deal of determination to tune in today, because I feel people talk about mental illness without embracing the person or family who suffers from the devastating effects. We were active in church and ministry, but when our family was suffering the most and we disappeared from church, no one even noticed. No one called or visited. And that's the end of the quote, Dr. Stanford. And so this person saying, you say the church can help, but we got burned, and that was part of our PTSD. How would you address that?
Right. Well, I would say, unfortunately, that experience is not uncommon. The church, much like you just mentioned that the church wasn't ready to jump onto Zoom when the pandemic started, the church is not effectively equipped to deal with mental health problems today. And that's why we've started things like the Gateway to Hope, where we're training churches. The vast majority of churches simply don't know what to do with someone that has mental health problems. They've been taught for at least a generation that mental health problems are primarily a spiritual issue, and that mental health care is something to be afraid of. And so, we really need to rethink that. So the first thing I would say to that individual is, please don't allow that church that mistreated you to represent to you how God feels about you and your mental health issues. God is with you. God wants to sustain you. God wants to care for you. God loves you. Your mental health issues in no way alter that. Secondly, there are churches that are better equipped and more supportive of people with mental health problems. And I would encourage you to try to find one, because that's an important part of recovery. And thirdly, make sure you're getting the best mental health care you can, because again, God has provided that care for us. And if you can engage that care, that can help you increase your quality of life and help you better have a better life. And so, those three things I think are very, very important. But I ache with you. I see people, unfortunately, every day that have been hurt by the church. And this is just really this is a difficult thing for the church. It is way, way behind the rest of society.
Yeah, boy, when I read that text, my heart goes out to you. That's so painful when that happens. And yet, as you say, Matt, find another church that hopefully will be more equipped to deal with that. If you have one bad experience with a dentist, hopefully you don't say, I'll never go to a dentist again.
Right.
Or one bad experience with a doctor, well, I'll never get medical help again. And, no one's perfect. That's not to make an excuse, but you were very hurt by that church. And I hope there can be another experience that would be more healing. Somebody's asking you, refer to an article referring to the views of God. Is there an article on that? And again,
there's actually a book that the sociology professors at Baylor wrote. It's called America's Four Gods. America's Four Gods, and it's just about that study and just about those four different images of God that people hold. So America's Four God, and Paul Frosch is one of the authors, and you can get it Amazon or anywhere.
Yeah, and maybe one of our team can type that into the chat area or whatever, and they can see that. How do you spell Frosch, by the way?
F-R-O-E-S-E.
Okay, super. I'm not familiar with this program called Hearts Transformed program, or is that yours?
Oh yeah, that's our that's our trauma support group.
Okay, so here's the question of it, and several people are asking about this. If we are all potentially experiencing extended trauma right now, which could lead to PTSD, would it be a good idea for many churches to begin Hearts Transformed now to help us through rather than waiting till later?
No, absolutely. And that's what we're recommending. And that's what we've been doing with churches here in the Houston area. I think if you're in the trauma and you can process the trauma while you're in the trauma, you will not carry it with you long term. What normally happens is a trauma happens and it's over, and then the person carries on the post-traumatic stress issues and then they have to process it later. Well, now is the time to process this, especially if you're struggling. So something like Hearts Transformed, or some type of a group or what would sometimes refer to as psychological debriefing, where people can get together and talk about how they're feeling about the COVID issues, what kind of problems they're having, what kind of successes they're having, can make a huge difference. So if you'll just go to mentalhealthgateway.org, the training is right there available online. It's free. And then you can download the workbook right off there, and it's also free.
Good word. Here's a very simple but profound question. Will God not heal me if I'm not a Christian? And if I'm not a Christian,
will God not heal me if I'm not a Christian?
If I'm not a Christian.
Well, I think that Jesus clearly heals people in the Bible that don't believe in him. So, I mean, I don't think that there's any necessary rule that says you have to believe in God to be healed. And I think God heals people every day in the world. Because again, for me as a believer, I believe God is healer. I mean, God is in control of all healing, and people are healed every day. So I think that's just part of his providential grace to us. And so, no, I think God can heal you. Although I would say that's just physical healing that you're asking us about. And I think there's a greater healing that requires us to have a relationship with him. And that's our full spiritual healing.
Interesting question. Is our image of God related to our image of our parents?
Yes, it absolutely is. That's a discussion that my colleague and I, who have been doing this research, often have. It's very possible that a lot of the image of God that you have is from your father, the image you have of your father, and then with things that you've been taught from the church or by your family or by others about God kind of put together. And unfortunately, what we find is when people have had a very difficult childhood, or particularly a father that was not loving or caring or was tyrannical or authoritarian, they will tend to put that image onto God as well. And then God is seen that way. So again, I think that's, we think about that, and then we think about scriptures where it says, fathers don't, exasperate your children and things like that. So, I mean, there's some clear reference to that, I think, in the scriptures, that we need to be careful as fathers and parents, because we are an image of God to our children, particularly from a very young age.
And I should mention, again, all of these talks and maybe part of the Q&A, I'm not sure, they will be available on our website at some point once we do some editing. And so this can be a valuable resource to your churches, your organizations, to yourself personally, you have the PowerPoints, you have the outlines, you're going to get the videos and accessibility to them. And so please know there can be a wonderful ripple effect from this weekend's conference. A theological question, and you kind of answered it in one of your talks, but it's one that's asked a lot. Shouldn't Jesus and God be able and enough to heal depression and PTSD? Why do I need drugs and treatments and psychotherapy?
Well, again, I mean, I would say the same. I mean, if that person believes that, would say that same thing for cancer or diabetes or things like that, then that's fine. I mean, I don't necessarily agree with them, but as long as their theology is consistent, make sure it's consistent. I think God has made us physical, and I think God has made us spiritual. I see churches pray for people with healing. I see that have cancer, and then I see them encourage them to go get oncology. So mental health problems are issues related to the brain, which is an organ like any other organ. And so I think, spiritual issues are an important part of recovery, but I don't think we should just focus on one. I would never tell you to just take medicine, because I think therapy is important. I think spiritual formation is important. I think these other things are just as important in that context. And if you just take medicine, you usually aren't able to get over all the symptoms. So I think that focusing on one aspect of our being is kind of to deny how God has made us. So what I would say to that individual is just, how would you think about other illnesses like diabetes and cancer and heart disease? And you should treat mental health problems the same way.
Great. As I mentioned earlier, we have an international audience today, at least 10 other countries represented. And so a question is depression, suicide, anxiety, PTSD treated in different ways in different cultures? And then related to that is the question of, how do we connect international churches who need pastoral care for their church members? So that's kind of a two-part thing.
Yeah, it is treated differently, and a lot of that is driven many times by kind of what level of care is available within a given country. Obviously, some countries don't have a fully functioning health system or mental health care system, and then they're also at different points as far as their availability of medications or things like that. So another thing I would say is, while in the United States, 7% of the population in a lifetime will experience PTSD, there are countries where that rate is way, way higher, because trauma is a daily experience. If you think about the Democratic the Congo, some of the African nations, even some nations in the Middle East. I mean, so there are places where trauma is so common that very high rates of PTSD. So yes, the way that it is treated is going to vary, but again, most of that is determinant on what's available. I will say this, you do find around the world, for instance, exposure therapy. If exposure therapy is performed for you by someone in your native tongue, in your country, it will be effective for you. That's just a fact. But we can always kind of, what is available? Is there some good pastoral care available? Is there medication available? It's really, ultimately, you want to be able to access what you can. And the second part was, I'm sorry, I've talked myself out of remembering what the second part of the question was.
Oh, it was a little, that, is there a way to connect
Oh,
international
yeah.
churches, those who need pastoral care for
Yeah,
their church?
actually, there is I'll give a plug for another group. The American Bible Society has a Trauma Healing Institute,
Didn't know
which
that.
is, they see trauma as a significant barrier to delivering the Bible to people. And so the Trauma Healing Institute through the American Bible Society has actually developed a trauma intervention. It's a faith-based intervention. It's much more like a Bible study. But it is effective. It is specifically for pastors to use, or churches. It's available in over 100 languages, and they do connect churches specifically in the context of trauma. So it's the Trauma Healing Institute through the American Bible Society. If you just go to the regular American Bible Society website, you'll be able to find it there.
In all of our homes, we have such a spectrum of response to what's happening in coronavirus or whatever. And one person's writing, again, a very tender question, saying that I'm married to someone who subscribes to several of those conspiracy theories that you had listed earlier, and who is also doing preparation for the battle or the crash that will result. And this person asking, how can I keep myself healthy and sane in my home? He wants to buy guns, bury gold, build a wall, store food, etc.
Yeah, that's a hard question. That's actually one of the hardest questions you've asked, to tell you the truth. That's a tough one. I mean, I'm assuming they're married. And so,
Yes, yeah.
I think that it's a difficult question because, she wants to honor her husband.
Right, and she wants support. She wants
Right, and
support.
she wants support. I mean, I would say, as I said before in a previous question, you can't control what other people do, but you can control what you do. And so, I don't know that for someone who is very dedicated to one of those conspiracy theories or that idea, I don't think you're going to talk them out of it. I think you certainly can make it clear that you don't necessarily believe that. I think it's very important that you find support outside that marital relationship, be that a support group or pastoral counseling, someone that you can talk to about your feelings. I also think you have to set up realistic boundaries here because, it's one thing if he feels like, okay, we need to, this isn't real. Let's say he believes this isn't real. We don't need to wear masks. Okay, that's one thing. It's a whole nother thing if he says we need to take all of our funds and we're going to buy gold and bury it in the backyard. And we're going to buy a lot of guns. And I mean, now we're becoming, it could become an economic disaster for your family, or it could be a physical disaster because guns are present. So, I think you have to have a conversation about safety with your husband. If you have children, I mean, you certainly don't want all these guns in the home, and you want to make sure you can provide for them financially. So, I think that you might be able to make some appropriate compromises, perhaps have a pastoral counselor serve as a mediator. But, again, you have to keep yourself safe. And ultimately, there may be some things you have to decide to do that might be damaging to the relationship if safety becomes an issue. So, get others, outside your relationship that can be a good sounding board for you and offer you support, even if it's a professional counselor. But I think it's something that can be weathered. Unfortunately, these things are very, very common. And a lot of it's being, kind of pushed by our media, on both sides. So it's really disturbing to see. And that's why I even mentioned that in that. I don't talk about those kind of things because I'm really a very non-political person, but I have seen this really get into the church, and it is, in my opinion, it's very much damaging the church and its ability to function during this pandemic.
Yeah, and not only the pandemic, but when Black Lives Matter came more into the forefront, that was tough for a lot of churches too.
Absolutely.
To deal with, or either to avoid or to talk about it head on and really discuss the issue. One last question, since that was your hardest question, so maybe this will be a little easier, is and again, these are phrases I'm not that well known of. do you have suggestions for treating complex regional syndrome as a result of a physical traumatic accident at work?
Okay, I'm not sure what complex regional, but I imagine they mean complex trauma. Um,
Mm.
yeah, again, complex trauma is treated very similar to just a regular trauma. With a complex trauma, it can happen very many different ways. It could be multiple traumas. It could be chronic trauma over a long period of time. It could be a dual diagnosis on top of, another diagnosis on top of PTSD. So, really what you have to do is you got to kind of tease the parts apart. Ultimately, for the trauma, you're going to have to receive some type of trauma processing type therapy. And so it's very important to get as your core mental health provider, a trauma specialist. And then you're going to focus on all these other issues. Typically with complex trauma, it's not a bad idea, even for a short-term inpatient stay, to begin to help you kind of move forward. But again, what I would say is, to make it simple, think about those four aspects of our being that I mentioned: physical, mental, spiritual, and relational. Okay, what physical issues are you having? Okay, well, let's get people. You want to have people in your life, be they professionals or friends or family, that can help you with those issues. What mental issues are you dealing with? What spiritual issues? So you want to get individuals, build a system around you that can help you grow and help you heal at all those levels that you may be struggling at.
Wow, that's so practical, just to think of those four things too. And um, this has been such a rich time to talk through all of these things, and him will try its very best to get resources out to you. And so in about a week or so, give us some time to do some editing. We will email you how to have access to these videos. And so that would be probably better. We'll just email it to you when it's ready and done, and how you can do it. And if I can say a few more resource things that you might find helpful, is that First United Methodist Church of Honolulu is hosting a free interactive webinar called Talk Story, Anxiety Management, with Anissa Weissman, who's the NAMI Hawaii Program Director. Again, NAMI stands for National Alliance on Mental Illness. And that's next Monday, July 27, from 6:30 to 8:30 Hawaii Standard Time. Again, First United Methodist Church, Honolulu, July 27, 6:30 to 8:30. Talk Story, Anxiety Management. Well, Dr. Stanford, what an amazing 4 days that we have had together, and you have just given us amazing tools and nuggets and so helpful. And I have one more message coming in. Oh, somebody's asking, and let's do this one live just before you sign off. Well, somebody's asking for any psychiatrist in Houston that could help this person's family. I don't know if that's hard.
Just have them call the Hope and Healing Center. Just call the Hope and just go to hopeandhealingcenter.org, and you can contact us there. We have a large referral database, and we would be happy to help them find care.
Yeah, I was just thinking that, just when you said that, that is the best way to find a good psychologist or psychiatrist in Houston, because you do have this great database. And so, is there a phone number, an 800 number for HHCI?
There's not an 800 number. No, there's not.
Okay.
We should probably get one of those.
Okay, so they'll have to look it up on the website.
Yeah, just hopeandhealingcenter.org is the easiest way. In fact, you actually can contact our clinicians right on there and ask a question on there if you want, or you can just get the phone number and call us. Right.
That's fantastic. And you are willing to help everyone everywhere. So that's so nice.
Absolutely.
So that's amazing. So thank you again for all the time you spent with us for the last 3 days, well, including preparation and recording and all the research. We thank you for all of the resources you have given us. Again, Hope and Healing Center .org is the way to contact that. And so grateful that your center could partner with us on this. And also thank you to the National Alliance of Mental Illness, NAMI, that helped us with this. Again, if you want some of Dr. Stanford's books, Logos Bookstore here locally. You can get it, and that'll be really fast for you, probably faster than Amazon. This whole conference has been for free, and so this is our gift, our service to the community. But if you do want to give a donation to help make these kinds of things possible down the line, we're hoping to do one a month. That would be obviously very helpful. Or if you rather give it to something else to help what's happening due to coronavirus, the food pantry is also looking for donations, and I think that there's a link for that, and the slide I think is coming up very soon about that. Also, for pastors and leaders, Jeff Schulte will be with us August 21 at 10 a.m. Hawaii time to talk about burnout, how to prevent burnout for our pastors or leaders of organizations, because I think, as Dr. Stanford has mentioned, a lot of leaders are doing double time trying to take care of coronavirus in addition to the normal stuff of the responsibilities they have to run their organization, or the tragedies or traumas that people are experiencing, and taking care of that in addition to COVID-19. So do know that at the close of this event, you're going to receive a notification asking for some responses in a very short survey, just to help us know how to improve for the next time, how to serve you better. It's only going to take probably 60 seconds max, and it'll be very helpful for us to design the future one. So please know about that. Again, thank you, Dr. Stanford, for taking time from your busy schedule to be with us.